Hi, good morning, guys. It is about 7:15 in the morning right now, and I'm in the car because I'm actually about to be on my way to my oncologist appointment. Today, I finally see my oncologist, and he's finally going to give me my results of my CT that I had this month. And it was in the beginning of the month. I'm not sure what day, but yeah, so I'm gonna go ahead and be talking to him about those test results, and then I have a whole page of like questions that I wrote down. So he should be answering those, God willing, and I'm gonna take you guys along with me just so you guys can go ahead and hear me out, hear him out, and yeah.
Yo te superé y que lo sepa el mundo, que ahora te quiero pero lejos de mí. Tú no eres buena y mucho menos pa' mí. Tus besos los extraño pero no como pensé. Fue lindo lo que hubo.
I'm walking in now, guys. This is the fit for this morning. I'm walking in. Let's go. Okay, guys, so I just checked in. I'm supposed to be going to the 4th floor, so let's go. So I'm supposed to be going to 420 to hematology oncology. I don't know if I said that right, but let's go. 420. This is the view. I'm nervous because this is where I would go to get my chemos, and it gives me bad memories, sad memories. Okay, so this is me now waiting to be called in from the nurse. They should be calling me in from here. And I'm wondering if it's the same nurse that would call me in before to always get my chemos. Her name is Sarah, so we'll see.
I love the jacket.
Thank you.
God, this is his computer. I looked, I was like, oh, that's a lot of messages.
Alright, thank you.
Thank you. So now I'm waiting for the doctor to walk in. This is my little room. I'm nervous. Ooh. See you guys in a little bit when he walks in.
Good morning. How
Hi,
are you
good
today?
morning.
How are you?
Doing
How you
good.
doing?
Good, thank you.
How are you holding up these days?
Better, much better.
You're feeling better overall?
Yes. Just a quick thing. Can I record for a reference for myself?
Sure, absolutely.
I have questions, that's why. So.
You put it here, it's easier to record.
Oh, okay.
Because then you can hear my voice directly.
Okay, perfect.
Great. So well, let's walk through kind of how you've been, how you're doing, kind of on a daily basis. Walk me through that, please.
Okay, so I've been taking my vitamins.
Okay.
Although I know for a moment my bones were starting to hurt, and what a coincidence that day that I had mentioned it to my mother that my bones were hurting, I received a phone call from a nurse, and she said that I needed vitamin D, so she gave me 12 pills that I had to take of, I think, like 50,000 milligrams, so once every week. So for 12 weeks I took that.
Okay.
And it was the vitamin D, and then ever since then I've been taking them. I actually just got off that one vitamin, and then she said after that I can go ahead and take regular dosage, so and then my other vitamins that go along with it, and then I mean everything else has been pretty well.
Okay.
I do have to say though that kind of like my left side, like my back area, bottom area, like has been kind of like bugging me.
Okay.
I'm not sure what it is and stuff. Sometimes when I do take deep breaths, like I can feel, I don't know, something here, like on my left side.
How long has that been going on for?
I mean, I mean,
Since the procedure
yeah,
itself?
yeah, yeah,
Okay.
since the procedure.
Okay. I mean, that could be attributable to scar tissue, for instance, but I just want to make sure, we're not missing an infection of any sort. Any issues with burning on urination, unusual discharge?
No.
No? Okay. Recent fevers, chills, night sweats?
Mm-mm.
Okay. Are you moving your bowels okay?
Yes. Oh, actually, I have noticed though. I wouldn't say they're like night sweats, but I do kind of sweat a little bit more in the night.
Okay.
Like I do kind of wake up a little musty, like if I was sweating throughout the night.
I see. And is that something that's frequent, infrequent? How would you characterize
It's infrequent.
it? Infrequent. Okay.
Yeah.
Just so on occasion, basically.
Yeah.
Okay.
But I never had that happen.
Okay. I see. Okay. And I'll check. I'm going to check some blood tests, your thyroid, for example, and a couple of other tests, just to ensure nothing else is going on from a hormone perspective. Okay. Yeah. I see that you slowly gained some of your weight back slowly.
How is that?
Which is okay. That's good. I mean, you're at 115 pounds, which is still under your baseline, correct? Because I think you were in the 120s historically.
Well, after my surgeries and stuff, I only weighed 97 pounds.
Yeah.
But,
So right now you're registering at 115,
right.
which is good.
Yeah.
Yeah, that's great. So I mean, we want you to, if you can, because prior to surgery you were in the 120s,
Yeah.
mid 120s. So
Right.
if we can slowly, kind of continue with the nutrition. Obviously, you don't have to get to 120 if you're comfortable at 115, right? But of course, we want to make sure that you're eating a balanced diet, appropriate, kind of a green-based Mediterranean type diet with a nice balance of the greens, the cruciferous vegetables, legumes, healthy proteins, staying away from fatty fried foods, trying to avoid processed foods, right? So, the more you cook at home, and the more greens that are on your plate, I always tell patients that's the best way to go about it. Okay, so the healthy proteins in terms of fish, chicken, turkey, tofu, right? Those are areas that we want to focus on to kind of really have that balanced diet. Okay. Your activity levels, how would you characterize them?
Honestly, I don't have like a routine where like I go walk and stuff like that. I'm just kind of moving all day because I do have like my 2-year-old.
That's right. I recall
Yeah, so
that.
it keeps me on my feet,
Of
and then
course.
my 5-year-old goes to school, so I have to take him to school, bring him back, cook. I mean, I'm doing the whole thing. I'm moving around all day,
Okay. All right. Okay.
so that's obviously more better like for myself.
Sure. Absolutely.
Back
Okay.
then that was a little hard too.
Especially after everything you went through. Absolutely. Now, emotionally, you feel like you've turned the corner. That was a very stressful period, right? With the chemotherapy, with the surgery. Of course, complications from that transiently. How you feel like you're
doing much better.
You're doing much better.
Yes.
Okay, you have a supportive network, obviously your family, friends,
Definitely.
and you feel like you're in a better place.
Yes.
Okay, very good. That's great. I mean, it's just, for a young person like yourself, Ms. Barbara, it's a lot. It's a lot to take on,
It is.
and especially as a young mom. And you did great. You really did a fantastic job. Getting through this journey was, again, it's hard for a full-fledged adult. I'm not saying that you're not an adult, but I mean, even for our patients who are in the twilight years, unfortunately, and they're afflicted with a cancer, it's really challenging. And I think there was so much going on with you, and there was so much on your plate, and you did a tremendous job. And so, and the CAT scan is a testament to that, right? You're in complete remission, you're cancer free, and obviously we're going to keep watching you, especially because of your age. Normally the standard of care is to monitor for 5 years after the procedure, but for yourself, we're going to monitor you for 10 years, okay? Just to be very careful, especially in light of the early diagnosis for you. Okay.
Yeah, and how often? I'm sorry.
Yeah, every 6 months.
Every 6
Yeah,
months.
so your next scan, is going to be roughly in July.
Oh, July.
Yeah.
Okay, perfect.
Because I want to make sure, it's a balancing act, because we also want to make sure, we don't expose you to too much radiation over time, right? From the CAT scan, because
Right.
every time a person undergoes, you need the CAT scans. because we have to follow you that way. But again, we can't like do a CAT scan once every 2 months. No one does that. Okay, that's not a good idea. And so standard of care is every 6 months in the field we do a CAT scan just to make sure everything is going okay.
Okay.
All right?
Yeah, and then I do recall that the CT was also just my chest, my abdomen, and my pelvis.
Everything, yeah.
Is there one where like if you could do like my entire body, like in my head included, or you wouldn't recommend that, or that's
Yeah,
not
it's not necessary. No. Just so you're aware. No. So we never, as part of surveillance for any gastrointestinal malignancy, we following chemotherapy and surgery, there's no requirement to do that. I mean, there's no indication for it.
Okay.
Right. So
Right.
you just don't need radiation exposure.
Yes.
To that extent. Too.
Okay.
So I'm actually going to preemptively put the order in for July. Okay.
Okay.
And have you followed up with your primary care doctor for routine health maintenance? Are you seeing
Yes,
Dr.
I had a
Deans?
physical already.
Okay, good. So,
Yeah.
and is the plan just to observe you once a year for routine care?
Yes.
Okay, good.
Well, and then also
Yes.
I wanna talk about how I looked over like the test results on the website.
Yes.
And it had said like the stable trace left pleural effusion or pleural thickening. So that word kind of scares me because I remember when I got diagnosed for like the stomach, it said like thickening of the wall. So that just kind of concerns me.
Yeah, no, that's just some inflammation there. Okay, that's not cancer related. It's about the way the lungs are inflated at that given time. So you have nothing to worry about that.
Oh,
Yeah,
okay.
those are just some of the combination of your breathing technique during the exam and also chronic post-operative changes. That is not that has nothing to do with the cancer.
Okay.
You're absolutely fine.
Oh, okay,
Yeah.
great. Yeah, and then I know it said moderate stool throughout the large intestine, but
You're a little constipated.
yeah, so I would just have to take the.
Yeah, so you have to either utilize, but I mean obviously improved hydration. That's where the greens come in as well from a dietary perspective, for your fiber source. But if that's not enough, then of course you can utilize a Metamucil, okay,
Yeah.
or Miralax, okay,
Okay.
both powder form. Don't take both of them, but just in the event that you need to, you need that added help to have consistency, I would recommend Metamucil.
Okay.
Okay.
And then just a quick question.
Yes.
What are like some red flags or signs that I should be like aware of or like just, to keep my eye out as well?
Yeah, so I mean I think certainly if you start to experience abdominal related symptoms, right? So new onset cramping, pain. Now that may not have anything to do with the cancer, of course, right? But if it's persistent, let's say 7, 10, 14 days, and now you're having abdominal cramps, you're having associated nausea, vomiting, you can't keep your food down, inexplicable weight loss, those are the things we need to know about, okay? Because any person who's had the type of surgery you've had is always prone possibly to small bowel obstruction, right? That means when basically the colon doesn't, or the small bowel doesn't move as readily as it should. And so that doesn't mean that that's related to cancer recurrence. It's just that you've had that inflammation from surgery and it can happen again, right? So someone can have slowing of their bowels. So, things that are like that, that's a glaring red flag, which obviously you're going to seek medical attention for, right? But that's really the main issue that you have to watch for.
Okay.
And I'm putting in
And then,
some blood tests for July, okay?
Okay.
Yes, go ahead. I'm listening.
Oh yeah, so that vitamin D right now that you're putting in that blood test. Is there any way that you can recheck that vitamin D
and then we can recheck the levels,
like,
no problem.
And then can we also go over again all the vitamins that I'm supposed to take? Because I know it's the folic acid, the vitamin D, vitamin B12, the iron, and I'm not sure.
That's fine. That's a good regimen.
Those 4.
Yeah. Are you and are your cycles active right now? Are you having active menstrual cycles?
Yes.
Okay. Yeah. So I think the iron replacement is important. Okay. I'll check on the. If you want to even do the labs a little bit earlier, you can even repeat these in labs in March. Okay. And I can check your iron levels just to make sure you're doing well.
Okay.
Okay. Yeah. No problem.
And then, I mean, obviously I'm an adult and stuff, so I wanted to go ahead and ask, like, what do you think about consuming alcohol, or at least just, I mean, what is your?
Yeah, so that's a good question. I think, I want to answer that question in a realistic manner, right? So,
Of course.
just so you're aware, and I know I'm pretty sure you are, with the latest research on alcohol and its impact on the human body, truly, if you really want to be accurate, no amount of alcohol can be deemed safe, just as a baseline. Now, of course, alcohol consumption is part of Western culture, right? For example, right? And so I think, for women in particular, there is some research that smaller amounts may be more harmful. Okay, just because of the body surface area on average, right? Women being smaller than men, and so theoretically, I always tell patients there's no quote unquote safe amount of alcohol, right? But if someone is going to consume alcohol, it really should be in moderation. Okay, so certainly I would limit it to no more than 6 to 9 ounces of alcohol per week. Even I'm not advocating that. I just want to say,
of course,
number one, no alcohol, right? But then is that steeped in reality, right? It's like saying don't ever have a donut or a muffin. I mean, is that? I mean, yeah. I mean, some people maybe will do that the rest of their life, right? But invariably, at some point, all of us are gonna have a slice of cakes, like a donut, a muffin. Most folks, if they're at a birthday, etc. Doesn't matter, whatever example you want to use. But my point is, certainly nothing heavy alcohol use, as far as hard liquor daily, bad idea, right?
Oh, no, of course.
So really, you really need to minimize it. Really need to minimize alcohol use,
Okay.
especially because of the prior cancer you've
Of
had.
course. Yeah.
Yeah. So So I mean, again, it doesn't mean that if you had a glass of wine, with your meal on a weekend or whatnot, or something like that, that doesn't mean that the cancer is going to necessarily return. We don't have data like that, but just you have to be very practical, and I kind of look at long term, right?
Right.
You have a 2-year-old and a 5-year-old. You went through a major scare. You have to do, and I know you are, everything you can to really maintain a healthy lifestyle.
Yes.
On all fronts, right?
Yes.
Yeah.
Thank you for answering that
Sure.
question. And then honestly, just like the last few questions, it's honestly just about conceiving. It's like you said, I'm not right now at this moment. I'm not looking forward to conceiving anytime soon. It's just a question to throw out there.
Yes.
And what do you think about like being on birth control, like putting my body through that, or can you give me like, your honest opinion, like what are the health risks, or what if it were to happen, or just like a little bit more information about. I mean, I know you're not an OBGYN, but
Yeah, so I mean, certainly that's correct. I agree with you, but you'd have to really get that information from the OB-GYN doctor. But let's say you wanted to have another baby. To answer that question first, generally speaking, we recommend 6 months to 12 months from the last time that you were exposed to chemotherapy, right? To attempt to have a child, right? 12 months is pretty much the standard, right, in the
Okay.
field. So, if we want to be conservative, we and that's on the real conservative side. We say 12 months without chemotherapy exposure, number one, okay? You can say as early as 6, but you're almost hitting 12 months next month, right?
correct, February.
So, yeah. Number 2, as far as birth control, there's no, again, that's a risk benefit. Birth control does have some side effects. Risk of blood clots are higher for women on birth control. Again, depending on the type of birth control, there are many different forms of birth control:
Right.
estrogen-based, progestin-based, some without any hormones. So, but if you're going to embark on birth control, that's a real dialogue you should have with the OB-GYN doctor. It's not going to per se increase your risk of this cancer returning. If that's what your
Okay.
question is. So
Yes.
if someone asks me, can you go on birth control? That's fine from a cancer
Okay.
perspective, from a risk perspective. But obviously you have to sit down because there's side effects with birth control drugs, right? One being the risk of blood clots are increased in a woman who is on birth control. Again, also dependent on the type of birth control, because there are many different forms now, right?
Yes.
Yeah.
So it would just be like finding, I guess, like the right one. Like
Yeah,
you
just
said,
asking the risk benefit of it with the gynecologist, right? So that's something that, but there's no my whole point is there's no contraindication to you going on birth control.
Okay.
Right?
Yeah, that
Yeah,
was a little
that's-
bit
yeah.
like my fear, you know, putting my
Yeah.
body through that.
Yeah.
But, okay, it's nice to know.
Sure.
Thank you so much.
Sure.
And I believe you answered all my questions.
Okay,
So thank
very
you
good.
very much.
No problem. I'll give you the phone back then.
Oh, thank you.
So we'll do labs in March. CAT scan I've already ordered for you, okay? I like to make sure you come and see us twice a year, just for routine care up to year 5, okay? And of course, once a year up to year 10, okay?
Okay.
Once you finish your next CAT scan, so August, come and see me, please.
Okay.
So that your CAT scan will be in July, and then when you're leaving, just tell Rosa or whoever check you in, one of my nurses, to put you on the waiting list for August.
For August.
Because that, by then you've done your CAT scan, and we can talk about that again.
Okay.
Okay, but I think you're doing great.
Okay. Okay. Thank you.
You are planning to have another baby. That's it's on your.
We would like to, but obviously not at this moment. Future. And then you said that you were gonna go ahead and check the
Yeah.
thyroid and
Yes,
that
yes. So for
stuff.
March, do all those labs.
Oh, okay, for
Yeah.
March.
Yeah.
Okay.
All those labs. I'm checking your iron, your B12 level. I'm checking your vitamin D level. So all those are in the system now.
Okay. Thank you.
Sure. All right. Good. Yeah, last year you were my youngest patient with a gastrointestinal malignancy.
Wow.
I had a couple of people a little bit older than you, but yeah, you were about my youngest. Okay.
So scary.
Good. Let me listen to your heart.
Hey guys, so I'm out the doctor's now, the oncologist appointment that I did have just now. I recorded everything. You guys can't see me and him physically, but he made me place my phone right there where his voice was gonna be loud and clear, so you guys can all hear his responses to my questions and also my test results. And if you watch that, that means you already know that I'm cancer free. Oh my God, thank God. I am so grateful. I'm so happy. I have 2 kids that I love so much, and you know, I live for them. So I'm so happy and grateful, and I look forward to making more videos like this. Thank you for watching. Follow me on Instagram. It's lovedrea_26. It's LOVEDREA_26. So thank you.